every 90 minutes, a teenager tries to die by suicide in this country. Every 6 hours, one teenager succeeds. And also another study that 65% people have no idea, adults don't have an idea that their child is going through mental health issues.
Actually want to see our own reflection. And that's what COVID made us do. It made us go inside because we couldn't go outside, right? People actually started facing their loneliness, facing their demons, facing their challenges, facing their feelings, and for once not putting it under the rug and also acknowledging it.
Across age groups, you talk about the elderly, you talk about the adolescent, you talk about the adults. Mental health does not discriminate. Adolescent, 1 in every 7 10 to 19-year-old has a diagnosable mental health condition.
So life skills don't need to be looked at one chapter. It needs to be looked at as a lifestyle. How does the teacher greet everybody in every or any subject? That matters. Empathy can't be one class. I'm going to teach you how to feel empathy or be empathetic. It is a lifestyle.
1,000 people, there are only 0.75 psychiatrists, and mental health professionals would be even lesser in that sense. So if you talk about that, we don't have enough people. So for every school, we don't have a counselor at this point in time. But is that the solution starting now? No. What we need to start with is basic training for teachers, basic awareness for parents.
Mental health conversations have been an integral part of Table Talk through the year and through its segment Hope Floats. But as we look ahead at a month of mental health awareness, here is a basic, crucial question. How do you identify mental well-being, and how do you ask an adult for help? Well, joining me on the show today are two ladies who've been working intensively and extensively in this field. Mimmansa is a psychologist with Fortis, and she's the head of their School for Mental Health program. Also joining me is Arushi Sethi. She's the CEO and co-founder of Trijok.
Identifying mental health, what is it that we can do to, sometimes there have been so many children who've written in saying that they don't quite know how to tell their parents what they're going through, or their parents don't understand what they are going through. The adults don't understand. And also, post-COVID, it's also the adults, who are stifling in a lot within themselves and bottling in. So the conversation around that, and I before I actually want to start this by some figures that I came across, we of course know that I think at the age group of 15 to around 30, 35, suicide continues to be the biggest cause of death. And also that every 90 minutes, a teenager tries to die by suicide in this country. Every 6 hours, one teenager succeeds. And also another study that 65% people have no idea, adults don't have an idea that their child is going through mental health issues, that their child is going through depression. And that is, where I want to focus and start. Things, have they blown out a little bit post-COVID as well?
No doubt about the fact. If we talk about WHO statistics, there have been a 25% increase in mental health conditions post-COVID. But I think we need to understand that mental health illnesses have been existing for a very long time. It's just that during the COVID time, since everyone saw how the mental health was getting impacted, is how the conversations also began to happen more and more. And so different stakeholders, different sectors, they've started to have more interaction about mental health, why it's important, why is it so significant, how it's impacting us. We started talking about, small aspects that are significant to our mental well-being, and how it's so important that we need to bring in that into our daily life. These conversations, need to really seep into each and every aspect of our life. I think that's where a positive change with the COVID of we really bringing that important aspect of mental health into our belief systems did come in. But I think the problem has been existing for a very long time. And you always bring in such important conversations around mental health and so many other aspects. Jyotsna, we're talking about adolescent today, but everyone for that matter, and different age groups, across age groups, you talk about the elderly, you talk about the adolescent, you talk about the adults. Mental health does not discriminate. So everyone gets impacted. And yes, like you mentioned in your statistics, adolescent, 1 in every 7 10 to 19-year-old has a diagnosable mental health condition.
No, Arushi, I worry that it's an Indian trait. COVID is practically over. The masks are over. We've moved on. Are we going to just forget and go back to where we were?
This is an epidemic that has existed so long and so forth. There has been acknowledgement and a wave of awareness has begun. That is also the reason we are having this conversation today. It has entered mainstream. Saying that, what happened with adolescents, adults, or any of us, and specifically even adolescents, I feel we don't always want to see ourselves because it could be a little scary. How many of us actually want to see our own reflection? And that's what COVID made us do. It made us go inside because we couldn't go outside, right? People actually started facing their loneliness, facing their demons, facing their challenges, facing their feelings, and for once not putting it under the rug and also acknowledging it. So I really believe that for adolescents, it was because and for all of us, we were forced to go on the inside, that so much that we were feeling came out on the outside. So in a sense, number one, maybe nature made us do it, but it was reflection that I really think a lot of us don't want to do, which is why we also shy away from taking the help we need. So one thing is acknowledging the help we need, which I think COVID did definitely, help us with. We were meant to reflect. We were made to reflect. Once we had that reflection, we became more aware, and then we started seeking more opportunities of help. So yes, I feel like once you see yourself, it also requires equal or more amount of work. And how many of us are ready to put that in? A lot of times, all of us feel if we speak to a psychologist, we speak to a psychiatrist, we do XYZ things as a fad, it's a magic wand and you'll be okay. The truth is, only you can help yourself. We're here to be the guiding lights and tools, but the maximum amount of work needs to be done by self. And that's what we need to empower all of our generations, including adolescents, on.
Also looking at these adolescents, these teenagers who are now going back to school, Mimamsa. School has started, and I've spoken to a lot of parents over the summer break, and everybody was pretty much holding their head because, education has not been the same. Right? So and when schools started behaving as though nothing changed, or in fact they went into double gear, trying to cover up for what wasn't there. Now, how do you balance this out? Because it's been increasingly unfair. I mean, loads of children who've gone through the summer holidays have been asked to do homework that was not taught in school, whether it was because, teachers were not equipped in handling it online or for whatever reason. How do we now make this system understand that, it's okay, whatever is lost, but it's okay, we've come out of this?
See, transitions take time, but the positive thing that, if you talk to young people, school-going children, they've been so happy going back to school. And I think that's the key point that we need to understand. My interactions through various platforms with these young people have been the fact that we are so happy to meet our friends. That physical distancing was not really bringing in that sense of connection, no matter how much we try, that we are in the digital world, and perhaps that was one of the ways of how we could stay connected. But it doesn't replace the emotional connect that comes in through a direct communication that even young people realize they need to have with their friends to be able to share their lives. We only show a part of ourselves on digital platforms through emoticons. You may be sending a smiley, but you may be feeling something absolutely different, back at the back end. And that has been one positive aspect. Academics, no doubt, yes, education was not the same. Education cannot be the same. In any case, in a very interesting conversation with a senior IAS officer, we were talking about, how we need to bring in mental health in schools. And he mentioned about, we both sort of aligned on this fact that it's so important that in education we bring in the aspect of, one, mental health, second, how the environment really influences the young people, and social media particularly a very important aspect of it, how it shapes them. And the third aspect is values. Education in terms of academic learning. You talk to a young person in today's time, they have more information out of syllabus than anything else. You have net, you go on YouTube's, education is being brought in, information is being brought in, knowledge is being brought in from different platforms in different ways. But what about the skills? Who is teaching that to the young person? Because that's what they need actually. How to really navigate through these aspects of their day-to-day life. That's where education needs to bring in a huge amount of change. Otherwise, whatever we are teaching them is just going to be redundant after a certain point in time.
Is life skills, what the kind of life skills that we are taught, was it adequate for us, for the children in the last 2 years?
The truth of it is, Joe, a lot of educational enterprises, and I will say this without any hesitation, the first thing that they had to cut off when COVID hit, because of how much they were hit, was the counselling system. It was the extended support that they had put into their teams, because they looked at it as an expense. So the first thing I want to talk about to all of our education institutions is, let's switch that lens. It is an investment versus an expense. And if you at the core realize the difference, so will the youth and so will the growth in your ecosystems. So number one, we felt a lot of, we work with multiple corporations, and it was sure everybody was, affected very, very badly. But at the time that you need to be giving more, holding back, cutting off, that gives the ideology of an expense rather than an investment. So life skills don't need to be looked at one chapter. It needs to be looked at as a lifestyle. How does the teacher greet everybody in every or any subject? That matters. Empathy can't be one class. I'm going to teach you how to feel empathy or be empathetic. It is a lifestyle. We need to be training our trainers in communication, behavior, execution, and definitely investing into programs for our children so that they don't look at life skills as one subject, but look at it as entirely life. Mental health is not in isolation. It needs to be in absolute inclusion. And when I mean inclusion, I mean 360 degrees. Whether it is science, biology, art, math, whatever you're doing. And sure, have programs that help us understand the core subjects, values of mental health to be able to execute it. But let's not look at it as a part. Let's look at it as a whole.
Something as simple as a child saying, I'm struggling with my examinations. I'm feeling the pressure. I know I'm studying day and night, and yet I feel that I'm going to fail tomorrow. How as a parent can you respond to it? How as a teacher can you respond to it? That's what matters. Expertization is not the solution, because in any case we have dearth of experts in the country. There's dearth of experts globally, but if we talk about in our country, 100,000 people, there are only 0.75 psychiatrists, and mental health professionals would be even lesser in that sense. So if you talk about that, we don't have enough people. So for every school, we don't have a counselor at this point in time. But is that the solution starting now? No. What we need to start with is basic training for teachers, basic awareness for parents. That's where we need to begin, because it's a huge problem. We are dealing with the mass. We are dealing with children, 13 years of young children. So it needs to start at the basic level, which means as a psychological first aid, as basic counseling skills, how can a teacher as a first responder just respond to a child's emotional distress? That's where it begins. So if a child is able to feel comfortable that I can go up to my teacher and just talk about how I feel it's a bad day for me, and the teacher is able to just respond to it in an empathetic, compassionate, whichever simple way, that they're able to sort of help the child feel relieved, that's our first step.
The other step, of course, Arushi, is ghar ka mahal, ghar ke log. How do we tell them that, how do they identify that the child is going through? Because, usually it's a phase, thak gaye, ye ho gaya. There are many ways of dismissing a child's well-being.
One common phrase we've all heard a lot of times, so jao sab theek ho jayega. Right?
Yeah.
Awareness needs to be twofold, and things need to be said as they are. Number one, as children, as the youth, let's empower ourselves enough to not use the masking technique. We do not need to put it under the rug. We need to say it as it is. If you want a biscuit, you say, hey, I'd like a biscuit. Say it, and say it enough. All right? Say it so much that parents, in the case it is awareness lacking in them, see, everything is twofolds, Joe. We cannot only entirely blame, parenthood or the child. Let's look at it in both perspectives. So number one, if children start saying it as it is, that is the first way we can encourage them. Say it as it is and say it enough. These two things. What happens when you reinstate something? It hits you at some point. How many times can your parents say that it is just your sleep or it is something, right? The parent is also going to think of it 2, 3, 4, 5, 10 more times. Definitely awareness is increased, but I also believe people are only going to be open to learning how much they want to learn. When you become a certain age, rigidity enters you and you feel you know it all. Very few of us are open to the idea of unlearning to relearn. So when it comes to that age bracket, I believe that if children are saying it as it is, they're saying it enough, there will be a shift right there. So number one, if you're feeling anything for prolonged periods of time, it could be a sign that you need to talk about it, reach out. Number two, let's say you have reached out and you haven't got the response that you're looking for. Reach out far and wide. Reach out diversely. Use your social media. Talk about it. You can have 2 friends, 3 friends, 1 friend. Today we do have the power of things to use them for the betterment, right? So let not only one thing be your support system in the case you're seeking for help. The third very important thing when it comes to identification is, I think there is a lot of knowledge available. So we need to become seekers and read the right resources. Today, I feel organizations like both of ours, whether it is Fortis or Trijog, we are, doing endless work to make sure quality information is reaching people.
Kansa, what would you, just offhand, what would you tell the parents or the adults? What are the quick signs, where they need to intervene?
Schools have actually done a very good job, even in the transition period. They've tried to give as much as they could, a slow down process, an easy adjustment process to the students. But yes, of course, there are going to be teething issues in any transition and any change. Similarly for parents, they've seen some changes, even students, children going through. And some of these signs where you do recognize and where parents have come in and they said, is this something that is happening as a lingering on effect, that my child is showing some of these signs? I'm not very sure as to what's really happening out there. And some of these signs are, one, if the child is continuing to feel irritable, mood swings are happening, if the child still feels that they're not able to engage socially, they're still struggling to connect with their peers, academic performance still continues to be a struggling aspect, not being able to perform to their optimum level, finding it difficult to concentrate and stay focused because, of course, from online, now switching to physical, online space also brought in a lot of distractions through digital aspects, and now coming to the physical aspect, the focus and the concentration is something that children have been really struggling with. And of course, sleep cycle, scheduling, routine, basic routine, getting back to physical activities, learning how to now rebalance, leaving the digital part and actually bringing in all the simplicities of life back. I think somewhere we may also be struggling with it, given the fact that all of us were so much more on digital than anything else. So we need to work with them in this process, which means as a family time, can we put aside 2 hours away of phone where we all just have an interaction?
I think withdrawal is also very important for us to take notice of. Withdrawal and isolation. A lot of times, isolation or withdrawal will not be explicit. There, as vigilant parents, we can learn to read signs and between the lines. So yeah, I think these 2 things we should also definitely take notice of. And if we're seeing them, we need to approach and have those conversations.
Yeah, because I mean, even that isolation. I mean, we may be out, but I'm not sure how many of us have internalized what it actually did to us when we were not
Yeah.
out, right? And one of the first reactions when the masks in schools were asked, were not made mandatory, and you could come to school without masks. A lot of the children around me said, "How are we going to go to school? We are so used to wearing a mask. We do not want to be without a mask." And and to me, that is actually deeper than what it sounds like, because these are children who forgot everything else. They were, whether this was, as somebody said, it was their safe space, or whether it was just whatever they were hiding behind, whether physically or mentally. But this was their comfort zone. And I think, I don't know how, whether schools are actually looking at this and addressing this. My kid's school has actually written this, that we will be bringing this up in the assembly, because they have figured out that it is actually a big deal. So what would you actually tell schools or parents and even children, who are now coming back into some normalcy?
Bring up Nansa's point here, transitions take time. And we as, we as change makers, whether you're running a school, you're running whatever it is, you need to do things not as directive orders, but give people the understanding and explanations behind why something is happening. The minute a human being feels pre-prepared, automatically there are multiple analogies that start in our brain. So we don't feel like we're forced to do something or anything is being taken away from us. We try to then empathize.
Nimansa, do you want to just add to that?
Talk more with parents, help them understand what really mental health is in very simple language. It goes down to just understanding that it's an illness, it's a problem, there are some signs and symptoms, we all can help each other. There are different layers of where we can help, how we can help each other, prevent it. And yes, when you feel that you continue to struggle with it is when you actually reach out to a mental health expert. It's like if you have a headache, you first take a pill on your own. If it still persists, then you take some rest. You maybe talk and reach out to your parent and tell them I'm not feeling okay. And when it continues, maybe for a week, 2-week period of time, is when your parent takes you to a doctor. That's how you treat your mental health problem or your mental health. Do all the self-care, positive things to take care of your mental well-being, and it needs to be done by everyone. It needs to be done by teachers, parents, children, all of us put together. Simple things of digital detox, taking care of ourselves.
So we all have a shower every day, right? You won't typically walk out of your house without having a shower. That's because it's been so ingrained. As systems, we need to make things mandatory for experience. That means while we're doing learning and development for our trainers, mental health should not be one thing we're training them on. There needs to be a series, developed for our teachers that goes in their teacher trainings. Same way for the admin, same way for the children. Yeah, and yes, I do believe in our experience, so this could be my thoughts or opinions. When you make things mandatory, at least you're going to try it. Because if you don't try, how will you ever know what it's worth?
Absolutely, but how do you make it mandatory in our homes? I mean, I get educational institutions, I get it. I get there's a system, eventually it'll be followed, somewhere there'll be more. It's a bit like sex education. Sometimes some schools will follow it a little bit better than the others,
Absolutely.
right? But the problem is the homes.
I think slow, persistent conversation is going to percolate deeper, slowly and steadily.
It will.
Just coming in, and I think what we just need to keep doing is keep moving forward. We are going in the right direction. We just have to keep taking it forward. I think in my experience, I've seen how people, even through telemental health, even from small cities, from small villages where you do not even have internet, actually going to a nearby place and saying, give me a certain time because this is when I can actually go and speak to you through internet. So telemental health has brought in that kind of a percolation where people in small parts and segments can also reach. Schools are more open to having mental health and mental well-being brought into their systems. It's just how we do it. I think slowly and steadily, every school, every house for that matter, when they will see, you look at the statistics, if we are talking about 1 in every 7 10 to 19-year-old, and if we are talking about 1 in every 8 adult globally, you will find somebody or the other in your family at some point in time struggling with some kind of a mental health condition. And this is just purely medical science statistics. And that's how you become more aware and open to understanding the fact that how you are aware of something as simple as what a thyroid problem is how you also understand how a mental health problem is.
For our homes, if I had to lend one thing, it would be communication versus under communication. We sometimes hesitate to communicate thinking, oh, will this beggar the situation or will it make it better? Communicate. That is what we need to empower everybody with. Hold that time, hold that space, but communicate versus under communicating. That is one key tool that I would definitely like to leave all of us with.
I cannot bring this up, the financial aspect of it. A lot of families would actually turn around and say,
Access.
This is not a priority for us to spend our money on. What do we do then?
Two things I will bring into this. One, I do feel no doubt about the fact that mental health insurance does need to come in, because we 100%. Are talking about an illness. And yes, government has put certain policies into place, but how we really apply that into the system is something that one needs to look at. So that no doubt, no debate on the fact that this needs to come in. Secondly, we also have to look at the perceived cost of mental health treatment, which means this is something that we are, is the quality of life and the impact that your mental health has on every aspect of your life. Because we're talking about impairment in your functioning, your personal, social, and performance functioning, which means if you have a mental illness, it's going to impact your productivity, it's going to impact your relationships, it's also going to impact how you even perceive yourself, and it is going to impact every aspect of your life, reducing your quality of life in that sense. So would I rather spend that regular treatment which is required? And again, there are different organizations, different hospitals who have different ways of how one can reach out to. So one needs to also be aware of where they can reach out to for accessibility in that sense. But we need to look at whether it's the quality of life that we are talking about over here when you actually get treatment for your mental health. So it's a perceived treatment cost also that one is looking at. If you do not prioritize it, you will always feel it's high. If you will prioritize it and you'll understand its impact, long-term impact, you would know that this is something which is important for me, I need to do it. And yes, along with that, mental health insurance needs to be there.
I definitely feel our government is making certain claims, but if we're taxed 18% on our GST, there's a very big gap over there. All of us are tirelessly trying to do things, and it's going to take time, Joe. It's going to take time for the right kind of access to trickle down to the tiers below. What Mimantha is saying, I still believe we're still talking out of slight privilege because we have the access to all of this. Sometimes we even maybe having the amount to spend on it, realizing whether it will work for you, not work for you is definitely a function of awareness. But what needs to be addressed over here larger than that is, what is the support that we're getting from our systems is what needs to be brought out on the forefront. How is our government supporting us? We need insurance on the table. Another thing I want to quickly bring to the table as we close this is, there's a lot of skepticism in investment because you don't know the quality of mental health out there in the system right now. The difference between an average counselor to a good counselor to a great counselor can really revolutionize a person's life. So a lot of hesitation, also exists that if I'm going to be investing this much, is it actually going to make a difference? And I can say in complete trust that organizations like Fortis and Trajog are actively trying to exactly change that, wherein if you look at it as an investment rather than an expense into your betterment, you are going to fly, you are going to feel better, and when you feel better, you do better. And we are here with you, and change is here and now.
Thank you everybody for joining me. Thank you, Mimantha. We'll connect with you again, and Arushi, always grateful to her for joining me.